Good afternoon. My name is Aisha Khan.
And my name is Neha Thermal.
We are doing a HOSA project on tuberculosis, and we would like to ask you some questions regarding this topic.
Let's get started.
What is your name and what do you do?
I am just going to go with Miss Mosier. You don't get my first name. I teach Anatomy and Physiology, and hey, look, I'm wearing my HOSA shirt.
Do you know what tuberculosis is?
Yes.
What are your opinions on the rapid spread of TB globally these recent years?
TB's been a really big problem for a while. It used to be a big issue here. Mostly it's an issue in some of the more developed areas where we have a hard time getting funding with some of the antibiotics because of antibiotic-resistant tuberculosis. It's been spreading. It's really an issue of healthcare disparity globally. Is usually where it comes up in discussion. So I think it's a good case example for seeing how you get healthcare disparities.
Yeah. Do you know anyone or have encountered anyone that has or had tuberculosis?
Not as far as I know. It does tend to hide in some people, but not that I'm aware of.
What is your opinion on BCG vaccine, if you know what that is?
I haven't actually heard about that. Did they make a TB vaccine?
Yes.
They have a TB vaccine, but it's not that common to get.
Oh, well, no. I guess only if you're traveling overseas.
Yeah.
Okay.
It's only for like kids, and in countries like India and stuff, like we're all like required to get it when we're like infants. Yeah.
Yeah, that makes
But
sense.
it doesn't really work well on adults.
Well, most vaccines, it depends, but a lot of vaccines are work better on young children because of how the immune system functions. That's why you do the vaccine, your normal like measles, mumps, rubella vaccine. All of that is in childhood.
Really, that's cool.
Yeah, your immune system is more effective. But
Oh,
vaccines as a whole, yeah.
Oh.
Our immune system gets worse as we age because of changes to the thymus gland. Y'all are just gonna get a lecture now. Just let me talk.
Kids get it that way. It can prevent future tuberculosis when they're older.
Yeah, that makes sense. That's how most vaccines. Some of them you need to redo again, right? And it doesn't
but
necessarily.
It's not like seasonal. It's like just once, you know.
But I'm an anatomy teacher, so I think vaccines are one of the greatest inventions medically that we have
Yeah.
made in decades.
Is there anything you've done to prevent TB? If yes, what might they be?
No. I teach TB. We talk about it.
Yeah.
So I guess that's my role, is informing people. But seeing as it's not one that we necessarily run into a whole bunch here, I've never done anything to prevent it. But I've also never traveled to a country where it's common. So.
What do you think are some good safety measures to take when preventing this infection?
Like just daily things that everyone can do.
I'm trying to remember how TB, it's respiratory.
Yeah.
Yes.
So.
It can spread when someone coughs or sneezes.
Okay, so general avoiding of people when they're sick, and if someone has some sort of respiratory symptoms, then staying away from people.
That's actually what we wrote. Do you think TB is a good topic to research on?
I definitely think So I find a lot of students when I go over TB have never heard of it before and don't realize how many millions of people are infected with it. Don't realize how many medications there are out there that you have to take a TB test before you're allowed to take it because of how they're immunosuppressants. So it's definitely an area where we have a lack of information, public knowledge-wise. So in that regard, yes, because people here don't know about it.
Out of all the places in the body, which do you think is most lethal that TB occurs in, and why?
It can spread to just about all of the organs after when it goes latent. So does it get into nervous system?
Yes.
Anything in your brain's pretty bad.
Yeah.
Yep.
So I might vote for that one. Only other one I would think is if you get into the heart, damaging heart muscle. That would be my two. That's my two guesses. I don't actually know what the right answer to that one is off the top of my head.
It's just like an opinion. It's just
Oh,
a discussion.
okay.
Yeah.
I know it spreads though. It spreads and it hides.
Anyway, Thank you so much for your time and patience today.
Thank you.